up?
Good morning. My name is Michael Chang. I'm the System Chief Medical Officer for USA Health, and I'm just here this morning to provide you with a brief update on where things stand with the vaccine for the COVID-19. Under the guidance of the Alabama Department of Public Health and the Alabama Hospital Association, plans are being made now for the distribution of the vaccine to several key hospitals around the state. The vaccine that we anticipate receiving will be the vaccine that's produced by Pfizer-BioNTech, shortly followed, probably within a week or so, by the vaccine from Moderna. The Alabama Department of Public Health and the Alabama Hospital Association have provided pretty stringent guidelines as to how the vaccine should be delivered to the recipients. USA Health and Children and Women's Hospital, University Hospital and Children and Women's Hospital are two of the 8 initial hospitals that will be receiving the vaccine when it comes out, which will be sometime in the next week or so, we anticipate, with several other hospitals around the state to follow within 24 to 48 hours after the initial distribution. So that's all I really have on the front end. I'll be happy to take any questions that you have.
Why was South chosen?
Well, I can't really answer exactly why South was chosen, but I can tell you that all the hospitals in the state were given the opportunity to fill out a rather extensive questionnaire from the Alabama Department of Public Health that included questions about how many healthcare workers you have, whether you have the ability to store vaccine at minus 80 degrees centigrade, and we ordered 2 of the super cooled freezers back in August when the announcement first came out. So we have 2 of the coolers, 1 at each of our hospitals. We also have been working very closely with the city on both the testing program for COVID-19 and actually piloted this with a flu vaccine earlier this year through our testing site.
You know how many vaccines you'll be getting initially and how those will be dispersed? I understand healthcare workers will probably be initially.
Yeah, so to my the distribution of vaccines has been distributed by the Alabama Hospital Association, and we're due to receive about 2,000 vaccines here at University Hospital and about 1,000 vaccines at Children and Women's Hospital.
And where will those initial 2,000 go? How will they be used?
So the Alabama Department of Public Health has very stringent expectations as to how they are to be given, and for all the hospitals. There will actually be about 15 hospitals that will be participating in this as the process gets rolled out. And that will be certain percentages for healthcare workers in the hospital, another percentage for nursing home employees, EMS workers, and then another allocation for physician offices. So it's pretty well spelled out by Alabama Department of Public Health and the Alabama Hospital Association as to how the vaccine will be proportionally distributed.
Have you been given any indication of how soon these follow-up shipments of vaccines will come in? Because I'm guessing that just USA Systems alone could probably use those initial 2,000 on its own healthcare workers.
Probably so. We don't know. So there's 2, as far as we know, there are 2 different types of vaccines coming. One is from Pfizer, the other is from a company called Moderna. The Pfizer vaccine is the one that requires the deep freeze. That will be the one coming out first, and we expect that sometime in the middle of the month. The Moderna vaccine, which could be stored with regular refrigeration techniques that all hospitals will have, is anticipated to come out about a week later. So sometime middle of the month to before the Christmas holiday. And both of those vaccines will be coming. We don't know exactly what the volume of the follow-up vaccines from the Pfizer company are, or what the follow-up or what the initial distribution will be for Moderna.
Is there any difference between the 2 different companies?
So the vaccines are both what we call mRNA vaccines, which speaks to the mechanism that they trigger an immune response and make the person that gets the vaccine immune to COVID-19. They're both mRNA vaccines. The Pfizer vaccine requires a booster dose at 21 days. The Moderna vaccine requires a booster dose at 28 days.
As far as the timeline, when do you anticipate that first vaccine being given out?
So we're making preparations now to be able to start scheduling and providing vaccinations to the appropriate recipients within 1 day, within 1 or 2 days at the very most of receiving the vaccine from the Alabama Department of Public Health.
So pretty much by next week, somebody could have the vaccine here in Mobile County.
It all depends upon when the FDA approves the drug to be dispensed under emergency use authorization, and from that point, the drug has to get shipped and distributed and stored. And so, as soon as one or both of those drugs are approved, then the rest of that chain gets put in motion.
So you're still waiting on FDA approval?
As far as I know, we're still waiting on FDA approval. That's correct.
Are there, I guess, what can you say to the fact of, why is it so important we have this vaccine right now, and how will this help in fighting the virus?
Well, we're in literally unprecedented times right now. In the state of Alabama and in this area of the state, the number of patients infected with COVID-19 is higher than it's ever been, even after that big spike that we had in July. And the vaccine represents a real opportunity for us to start to get a handle on the spread of this disease. We anticipate what we feared before Thanksgiving holiday is actually happening, and that is that the incidence of the disease is going up. We're now 6 days out from Thanksgiving, 6 or 7 days out from Thanksgiving. The incidence of disease is starting to go up dramatically across the state and actually around the country. So we just need everybody to hang on with all the things we've been doing, with the social distancing, wearing a mask, staying six feet away from people, washing your hands diligently, all those things. Now's not the time to give up. We've got to hang in there with those things as the vaccine gets distributed, because it's going to take months to distribute the vaccine across the entire population at the very least. So we still got a ways to go. We can't let down now.
We've been getting a lot of questions, and I feel like this is one that you might want to speak to. A lot of people asking, is it safe? Would doctors take it? What do you have to say about that?
We believe the vaccine is safe. We've told our employees in our healthcare system that it's safe to receive the vaccine. There are side effects. Probably about 10 to 15% of patients have important side effects that actually, they can feel or that are reportable. But if the FDA believes it's safe, we're going to go full speed ahead with it. Personally speaking, I'm going to, as soon as my turn comes up in line, I'm going to receive the vaccine. So that's our recommendation.
Dr. Chang, so I understand how these first 2,000 or so doses will be used. Will those all essentially be boosters for 2,000 people? Then they'll be scheduled to come back and get their follow-up at a point in the future? Or how will that work?
That's exactly right. So we are creating a scheduling system that will allow people within each of those groups. Again, there are 4 groups. Healthcare workers within the hospitals. Number 2 would be emergency medical personnel. Number 3 would be nursing home personnel. And number 4 would be physicians in the outpatient offices. The scheduling system that we're creating will allow scheduling by group over time in the allocation and the proportions that the Alabama Department of Public Health has specified. Those people will come in at a predetermined time, receive their vaccine, and at the time of their vaccine, be given a reminder and scheduled for the follow-up dose or the booster dose at 21 days or 28 days, depending on the vaccine. They'll also be observed for 15 minutes to make sure they don't have any immediate side effects. All this will be done under appropriate social distancing precautions, and we will obtain from them contact information so that we can schedule their booster dose at the appropriate time interval.
So does that mean then that people will be notified via that system when it's their turn to get the vaccine?
As I understand it, it's going to be left up to the various facilities that are giving the vaccine to work out the best way to schedule the follow-up dose with each person that gets the vaccine.
And with that 15-minute period, it kind of sounds like drive-through will not be an option for this vaccine. It'll be like an in-office kind of a visit.
Drive-through will be an option. I can speak for USA Health. We're going to have three vaccination sites, one within each hospital and one drive-through site at one of our hospitals. We haven't determined which one yet. But the mechanism for doing that is very similar in a lot of ways. The infrastructure is similar to what we've been doing in our partnership with the city with regards to the testing and the flu vaccine distribution with the city. So we think we're ready. We just have to pick the best site.
Is there any way to know at this point how many of those 2,000 initial doses will go to healthcare workers here at USA versus healthcare workers at Infirmary or Spring Hill, or you see what I'm saying?
So that's a great question. Of the doses that each hospital will receive, now remember, one of the first things I said was that there are 8 hospitals across the state that will be the pilot hospitals for the pre-positioned vaccine, but there are about 8 or 10, up to 22 other hospitals across the state that will be receiving vaccine within, as we understand it, 24 to 48 hours after those initial 8. So as we understand it, all the hospitals are being told to use the vaccine within their facility for their healthcare workers as a first step.
Alabama's only getting about 37% of the tests that we initially thought we were getting. How is that impacting distribution here in Mobile?
Well, it's just going to delay the ability to vaccinate the populations in the order that we've been instructed to vaccinate those populations. It'll just spread that out over further time. I mean, it would be nice if we had all that we were initially requesting or allocated to be able to hit those populations more quickly, but we're not. We'll just have to spread it out and work with what we have.
Are you personally, I know you're happy that we're finally to this point, but are you surprised it took this long, or do you think this is sooner than you expected as a country?
I think this is sooner than we were ever expecting. You know, there's never been an mRNA vaccine brought to market before this time. So this is new technology, and it's unprecedented. And the fact that they've gotten in the time frame that we have, and gotten through the safety tests that have been carried out up to this point, I think is remarkable.
Do you have any idea when the general public might, be able to, go and get their vaccine?
So that's a great question. That the Advisory Council for Immunization Practices, which advises the FDA, has laid out for the FDA and the CDC, and therefore cascaded down to all the state departments of public health, the way they believe the vaccine should be given in terms of the population. There are 3 broad phases. There's phase 1, phase 2, phase 3, based upon the availability of the vaccine. We are early in phase 1, which we call phase 1A. When the vaccine becomes more broadly available and we can start inoculating the general public, will be sort of a continuum from 1B into phase 2 and phase 3. The population of people out there that are higher risk will be worked into, I believe it's 1A or phase 2, and then it'll go on down. And like I said, this is probably going to be several months in distribution.
The booster dose time frame, 21 days with one, 28 with the other. Does that mean that patient who gets that initial booster has to be back on day 21, or has to wait at least 21 days before they get their next one? Is there an effective range that second dose has to come in?
That's a great question. So those intervals were picked based upon comparing the degree of immunity in people that had received an initial dose of vaccine with the degree of immunity that patients that have survived and recovered from COVID-19 have. To our knowledge, as best I understand it, I'm qualified by saying that, as best I understand it, the initial dose starts the development of the immune response, but the booster dose is required to get to the threshold and get you beyond the point to where you have the degrees of immunity that patients that have recovered from COVID-19.
Do we know yet how often you have to take the shot? Is it seasonal? Is it annual? Is it once in a lifetime? What?
We don't know yet. And to get back to your question again, 21 days for the Pfizer vaccine, 28 days for the Moderna vaccine are the minimum time. We know that you can go a little bit past that time threshold, but we don't know how far.
Okay. One last thing I've got.
Sure.
We've got some of your caliber in front of us. We hear a lot about the amount of doses that need to permeate the U.S. to have what's called herd immunity. You keep hearing that term. Can you break that down in a simple way for folks? How does that work, and why is it that everyone would have to have it in order to knock this virus out?
So the concept of herd immunity, the idea behind herd immunity is to get enough of the population immune to the disease that the disease can't continue to spread at a rate that is uncontrollable. It doesn't mean getting everybody in the population immune. It means getting the the percentage of people in the population to a point where the disease can't spread anymore. Those are two different things. We think that herd immunity would be achieved at a immune prevalence of somewhere around 70% in our population, I think, 70 to 80%. So that would mean that the percentage of people that have had the disease and recovered, as plus those that have been effectively immunized, would be in that target range. That would be the point at which we think the transmission of the disease would be low enough that we could really get a handle on this, and we could start moving back towards normal.
You mentioned the different phases of administering the vaccine. When do you and you mentioned when do you foresee the general public being able to get it? Can you you mentioned in a matter of months, that kind of thing? Can you fine tune that maybe like within like April through June, or maybe May through August?
I wish I could, but that depends upon two things. It depends upon the availability of the vaccines that are being approved or reviewed right now by the FDA, and it depends upon whether or not other vaccines come out that we haven't heard about yet. In other words, it's going to take more than 2 vaccines, we believe, to achieve what we need nationally and worldwide. And there are literally dozens of companies working on other vaccines. So it's impossible to say. I can't give you a date because we don't know, number one, what the availability of the 2 vaccines that are imminently going to be approved are, and number 2, we don't know what else is coming down the pipeline.